All right, buckle up because today we are taking a deep dive into some fascinating work being done in diabetes care.
Oh, really?
Yeah, we're going to be looking at the career and really the whole approach of a physician in Taiwan,
Huh.
Dr. Su Te-tu,
Okay, interesting.
and the research we have on him. Seriously impressive stuff, especially if you, like me, you're interested in how we can move beyond just medication.
Right, getting to the root of it.
Exactly. This isn't just another doctor giving out prescriptions. Dr. Tu is all about empowering his patients to take control of their own health. It's a whole different way of thinking about diabetes care.
So tell me more about this, Dr. Tu.
Yeah.
What makes him stand out? We're talking top tier in Taiwan's medical scene,
Oh,
right?
yeah. We're talking numerous awards, leadership roles, board memberships. This is someone who's at the very top of their field.
And knowing how rigorous the Taiwanese medical system is, those accolades mean something. It speaks volumes about his dedication.
Absolutely. And it's not just about the accolades, is it? It's what he chooses to do with that expertise. There's this quote from him that really stuck with me. Something about how even the best medical advice can get lost in the constant flood of information, misinformation even, that's
Yeah,
out there.
right. It's like a signal to noise problem.
Yeah, exactly. And what I took from that was just how crucial patient education is and how important it is for doctors to be proactive in their care.
And that's what I find so fascinating about Dr. Tu's approach. He's a huge advocate for what he calls proactive case management, basically getting ahead of the curve, predicting and preventing problems before they even arise.
And a big part of that is giving patients the tools and knowledge to manage their own care more effectively. Like he developed this insulin adjustment dial.
Oh, yeah, I've heard of that. It's actually brilliant.
Right. Talk about putting patients in the driver's seat. They can actually adjust their insulin doses themselves based on their blood sugar levels.
It's a perfect example of how Dr. Tu's empowers his patients. He doesn't just treat their diabetes, he teaches them how to manage it, how to make informed decisions about their health.
It's like the difference between being a passenger and being the one with your hands on the wheel, you know? You're in control.
Precisely. And what I think is really important to highlight here is that Dr. Tu's approach isn't just about the technology or the dials. It's about a fundamental shift in the doctor-patient relationship.
100%. And it's also about recognizing that diabetes care isn't one size fits all. You have to look at the whole person.
Exactly. He emphasizes nutrition, exercise, mental health, all those aspects that play a role in managing diabetes effectively.
I was really struck by that. It's about understanding the person behind the illness, you know? It's not just about managing their blood sugar, it's about improving their quality of life overall.
Right, and that's where his holistic care model really shines through. He personalizes dietary plans, encourages exercise, provides specialized screenings, and even addresses the emotional and mental well-being of his patients.
It's really quite impressive. And his methods get results too. I mean, one of the studies we looked at mentioned a pretty significant reduction in dialysis cases among his patients.
That's a huge win, and it really underscores the effectiveness of his proactive approach. Early intervention, personalized care plans, it all adds up.
It really makes you think, what if this kind of preventative, holistic care was the norm? What if more healthcare systems adopted this patient-centric approach?
Now, that's a question worth considering. Imagine the potential not only for individuals, but for healthcare as a whole.
It's a future I'd like to see. But of course, there'd be challenges too, right? Like, how do you implement a system like this on a larger scale? How do you ensure everyone has access to the resources and support they need?
Right. And how do we address things like healthcare disparities and ensure that everyone, regardless of background or socioeconomic status, can benefit from this kind of personalized care?
It's complex, but I think Dr. Tu's work gives us a really important framework for thinking about the future of healthcare. He's showing us what's possible when we empower patients and prioritize proactive, holistic care.
He really is a bit of a visionary, isn't he?
He is, and it makes you wonder, what other innovations are out there? What other ways can we empower patients to take control of their health and well-being? It's a pretty exciting time to be looking at these issues, that's for sure.
Definitely.
Well, that's all the time we have for today's deep dive. We hope you found this exploration of Dr. Tu's work as fascinating as we did. It's a topic that deserves much more attention.
It really does.
And for our listeners, think about this. How can you be more proactive in your own healthcare? What steps, even small ones, can you take today to advocate for yourself and your well-being?
Excellent question to ponder.
It is. And we'll leave you with that thought. Until next time.
Bye for now.
See ya.